Healthcare crisis across rural America is growing. A new report out of Minnesota shows demand for long-term care for the elderly will skyrocket over the next 20 years. And the biggest hurdle is staffing shortages. The U of M is matching about 35 of its med students a year to more rural areas where they learn a broader skill set and become well known in the community.
So if we can get students to experience that, then, like our program, they're 3 times more likely to go back and practice at a rural spot.
Well, the shortages go beyond doctors to pharmacy techs and nurses, particularly at nursing homes, forcing many of them to close. Jennifer Hoff has more on what's being called the perfect storm. Jennifer?
Julie, jobs are so hard to fill, and the higher wages aren't necessarily helping. Patients are sicker, costs are increasing, and there are so few beds, some counties now just don't have any.
In Minnesota, 8 nursing homes closed last year. In the 3 years before that, another 15, including one Jenny Gleason oversees.
It was excruciating. It was so painful.
The facility, some 3 hours southwest, was converted to assisted living. Staffing shortages, one of the biggest reasons why.
When we are constantly searching and calling everyone to say, can you come in and work overtime? Can you do this, right? Like, everyone is stressed. And it's not that people don't want to do a good job or want to be there, but they need balance too.
A new report from the Center for Rural Policy and Development says demand for nursing beds won't even peak for at least another 20 years, when its data shows more than 37,000 people will need one. The report also shows patients are more sick, reimbursement rates too low, and some wages higher. That will go up even more as the state's newly formed Workforce Standards Board voted to raise minimum pay and benefits in 2026.
Figuring out how to get the cash up front to fund that is really, really challenging, especially after going through COVID, when organizations like mine put every extra penny we had into just making it through.
The most severe declines are depicted by the darkest red counties, including Red Lake, that lost all its beds. Cass only has 33 left, followed by Grant and Swift.
I do feel like there are some really big shifts happening in the industry.
Some big shifts indeed. That report says Chippewa County is the only one to actually have more beds because the state's Department of Veterans Affairs actually built a new facility there just this year, as other locations just have to keep getting creative with recruitment, and some are even pushing back on barriers. They want fewer barriers, and some of which include the new federal minimum staffing requirements. Julie?
All right. Thanks so much, Jennifer.